Hello and welcome. Thank you so much for joining us today. I'm Ann Curtis, Director of Staff Learning and Development within Human Resources, and I'll be your moderator today. We're so pleased to have a distinguished group of panelists with us from across the whole university at this first, but not last, Return to Learn Campus Staff Town Hall to answer your questions. Thank you for submitting questions in advance of the session today. I encourage you to continue to submit questions through the Q&A module on your Zoom screen. And before we jump in with some updates and begin answering your questions, I just wanted to start with acknowledging two things. The first one is that unfortunately we won't be able to get to all of the questions today. That's a testament to the great number of thoughtful and important questions that you've asked. So I wanted you to know that we are committed to continuing work on bringing those questions that we couldn't address in the session today to an FAQ that will be on the Return to Learn website. So keep an eye out for that, more to come. The other thing, and just a quick reminder that the Return to Learn website is returntolearn.ucsd.edu. The other thing that I wanted to do to just provide sort of a frame for the conversation today is to acknowledge what is no surprise to any of us, which is that we continue to be in a time of great change and great uncertainty. And as we all know, that means that sometimes the information that we receive and the situations that we're responding to change very rapidly, sometimes even on a daily basis. And that asks all of us to continue to be proactive and adaptive in everything that we do for UC San Diego and our community. And it means that sometimes our responses and those changing circumstances are going to require us to be adaptable, flexible, resilient, to be compassionate with each other and share some grace. And we really believe that UC San Diego has all of these amazing qualities. And I'm certainly honored to be a part of this community. So with that kind of frame, I would like to welcome Chancellor Pradeep Khosla for some opening remarks. Chancellor?
Thank you, Ann, and good afternoon, and welcome everybody. Never did I imagine that I'd be able to address 2,000 plus of you all in one shot, all in one place. So on one hand, one can thank this pandemic and the sudden change in our mode of operations that it has created. But on the other hand, one can also be concerned about this pandemic. And the whole return to learn strategy is our way of thinking about how do we think about safety of our colleagues, being students, faculty, and staff members, all at the same time, while they're effectively and efficiently working away. How do we think about their safety while still bringing the campus back to life in a physical form? And it doesn't have to be coming back to life in a physical form 100% of the time, but as much as we possibly can. So about 16 weeks ago, when the pandemic hit us very strongly and the closings were announced, together, we as a campus and all of us individually and collectively overnight changed our mental model, changed our mode of behavior, and started working as if we were working in a remote fashion throughout. And this has impressed me significantly. This points to the resiliency of our staff. You all have been so amazing. You're working harder, I know that. You're more stressed out, I know that. That causes other problems that we should be dealing with. And the technology always is not working as smoothly as it should be, but nonetheless, we're working towards removing all of these impediments. So Return to Learn was thought of as a way of like, what do we do to bring this campus back to life? And we put together multiple task forces headed by vice chancellors, staff, faculty, involvement from all constituencies throughout the campus. And what we have are multiple strategies now on how we're going to create academic continuity, research continuity. How are the staff going to continue to work both remotely and sometimes in person if and when the need is? How's the housing going to be populated? And I've been communicating with all of you through campus memos. And because of this technology, yet one more time, we figured out that maybe we can communicate with all of you, at least through this technology, and have a conversation rather than just write passive memos. So let me first say thank you to all the task force leaders, all the participants. Your input has been spectacular. And I know that in your decision making, you have taken scientific evidence into account. You've made your decision on a rational basis, and our faculty have provided significant expertise, and some of them are on the panel today, on how we're going to be opening. And secondly, let me just say a big thank you to all the staff. I know there were hiccups in this transition. Nothing is ever smooth, but you all have been truly amazing. Your resilience has impressed me so much. I was always very impressed with the staff, but this time around, my hat's off to you. Thank you for hanging in there. Thank you for supporting your great campus. Thank you for making us a better place. And thank you for being there for all of us. So back to Nancy now for the next level of comments. Nancy Resnick, our Chief Human Resource Officer. Nancy?
Thank you so much, Pradeep, and thank you, Anne. And good afternoon, everyone. I also will say it is astonishing that we're together in this way with over 2,000 staff members participating. It is just amazing. So I'm Nancy Resnick. I'm very proud to say that I am your Chief Human Resources Officer. And I really appreciate everyone joining us today. I'm very excited to be launching this first of our staff town halls. And I think this connection as a staff community is of vital importance. And I do think, you know, Zoom is a very interesting experience for us. It's very egalitarian. All of our boxes are the same size. We don't have to travel to get together. So there are many benefits for us to explore. But at the same time, I do want to acknowledge that truly this is an extraordinarily challenging time for all of us. The pandemic is impacting all of us in many ways. There's many new stressors that we are confronting as part of our lives, including and not limited to anxiety about the public health situation, balancing caretaking and other responsibilities at home, distance learning responsibilities, and there are many uncertainties in our world. So I think that part of the basis for our gathering together is to really speak to what we can and to assure you that we will be committed to providing more information when we have it. I think we also want to really acknowledge that there are critical new possibilities here related to workplace flexibility and innovation. I also really want to say, and I want to echo what our Chancellor said, it has been incredible and awe-inspiring over the last few months to see the staff faced with an unprecedented global crisis, how we are demonstrating just unbelievable reserves of resilience, of compassion, patience, and flexibility. The creativity and the innovation that I see every day as we learn to work together in new ways is truly remarkable. And I would like to thank each of you for all the ways in which you are contributing to that and for everything that you do. So we do know that this is a very rapidly and continuously evolving situation. There are many, many complex factors in play that kind of underscore and inform decisions that campus leaders are making. While we, again, as we've said, we may not, and in fact do not have all the answers right now, and at the same time, we're very committed to providing answers when we have them, to providing you with up-to-date information as often and as soon as we can. And of course, in all our decisions, the health and safety of our campus community is our top priority. So when we talk about issues and questions related to the staff experience and to human resources, I also want to say this, there may not always be one single standard answer that applies to everyone. We have a very broad range of staff roles. Our campus, clearly relies upon staff in myriad ways to run the very complex organization that is UC San Diego. So really, in a certain sense, while we have framing rules and policies that we can help with, at the same time, there's an aspect in which each person's situation is unique. And that's really why Human Resources is here to support you and to help you navigate complex situations and challenging conversations. We are your colleagues. We are committed to standing with you and to providing you guidance and support through this time of challenge. And so again, thank you so much for participating today. And with that, let me hand this back over to Ann Curtis. Thank you.
Thank you so much, Nancy. So next we would like to begin the first of our 4 updates, and we'll start with Dr. Natasha Martin, Associate Professor and leader on the Return to Learn project, to bring us up to date on the Return to Learn program and the state of the pandemic.
Thanks. Good afternoon, everybody. So, as people are no doubt aware, unfortunately, we have an expanding COVID epidemic recently across the United States and here locally in California as well, with new cases increasing day on day. Next slide. We are, of course, monitoring the local situation. In San Diego, we also saw an escalating number of new cases throughout June and July. There appears to be potentially some optimistic stabilization of that in the recent weeks. And we continue to monitor the situation closely. But as you may have been hearing in the news, of particular concern is that we do know that many of the new cases recently are among young individuals in younger age ranges. And so we continue to monitor the situation. Next slide. And in fact, our team has developed some predictive simulation models. This slide shows predicted hospitalizations, but basically in conjunction with detailed epidemiological review of the data and monitoring of the epidemic, we're also forecasting the epidemic to try to predict what things will be like in the future weeks and months to continually assess the situation as it evolves, and also to feed this information into other models that we've developed in terms of campus transmission dynamics to help us understand how we can best reduce the risk of COVID transmission and detect outbreaks on our university campus. Next slide. So the 3 main pillars of the Return to Learn program are really pillars that are aimed at detecting outbreaks early and reducing the risk of transmission if an infection is introduced on campus. And so we know that we can't reopen campus to ensure no risk, but we want to reduce that risk as much as possible with our program. And so the 3 pillars that we have are risk mitigation strategies. How can we reduce the risk of transmission on campus through things like masking and sanitation programs, but also structural configurations to campus, such as de-densifying housing to only singles and doubles for the students, reducing the maximum classroom size, and shifting some courses and having hybrid instruction. And all of that are kind of things that we can do to help reduce the risk of transmission on campus. Viral detection is our second pillar. The aim of this is really to detect outbreaks early through our symptomatic and asymptomatic testing programs, as well as our environmental monitoring. And of course, once we detect any infections, we want to prevent any further transmission of those. And that takes place under our third pillar, which is really the public health intervention side that incorporates case isolation, contact tracing, and exposure notification. And of course, the situation is changing, the situation on our campus as well as in the broader community. So we really wanted to have an adaptable framework that will always kind of be data-driven, taking the most recent information and making sure that we can adapt as we go in the most efficient manner. Next slide. So just a little bit more detail, some of the things we're thinking about in terms of reducing the risk of spread, other than the de-densifying the housing in the classrooms, as I've mentioned, there are also detailed sort of physical and environmental assessments and engineering reviews going on to make sure that our sanitation and our ventilation systems are adequate for reducing the risk of transmission. I mentioned early detection. We want to quickly identify and provide care to anyone who becomes ill. We're also actively looking for the virus in environmental samples, such as in wastewater and sewage, to see if we can detect an outbreak early. And of course, our periodic testing of asymptomatic faculty, staff, and students will enable us to detect outbreaks at their earliest stage so that we can respond. Isolation of infected individuals while they're infectious will be important, and we are taking great steps to ensure that we can provide those living on campus with isolation housing and support, and notify and support those with exposure to infectious persons so that we can prevent any more infections. And as I mentioned, we have an adaptable framework. We're looking at the changing conditions as they occur, and we're using that new information to adapt our strategy. Next slide. Thanks.
Thank you so much, Natasha. Our next update will come from Vice Chancellor and Chief Financial Officer Pierre Huillet to give us a brief update on fiscal and budget issues. So Pierre, take it away.
Thank you very much, Anne, and hi, everyone. A couple of slides just to show the financial impact of the pandemic to the campus and talk about what we have done to address these issues. So the number is pretty staggering, as you can see on this slide, north of $600 million, pretty evenly split between the campus on one hand and the health system on the other hand. And on the campus side, it's a variety of factors, and most of them are very indirect. There are COVID-related expenses, but a lot of the issues that we're facing are more on the revenue side. So the state has cut funding. They rolled back the increase first, and then they kind of further reduced it. The regions were not comfortable approving tuition increases for the students. Of course, we have refunded housing for the students who left mid-quarter, and we experienced fairly heavy losses of revenues across the auxiliaries. We experienced clinical revenue losses as well, both for the School of Medicine and, of course, for the health system, as we needed to make space for COVID patients. So large numbers, I would say they're pretty much in line with other campuses of similar sizes. Next slide. So the campus responded pretty very quickly, actually, and so far, I believe quite accurately, and I'm fairly proud of that. So we focused on expenses kind of right away. We decided to defer a number of capital projects unless they were already in progress or they were housing related, as we will need more housing than ever. We implemented a budget reduction across the entire campus, and I'll come back to that. The system as a whole implemented a salary freeze for policy-covered employees, both academic and staff. And then, of course, we're working very hard to maximize government support, whether it's reimbursement or research funding, although the reimbursements are fairly limited in scope. In terms of how the units are dealing with the budget reduction, I always say that the biggest lever that we have and that we put in place immediately is around the hiring freeze and using attrition to reduce position. And it has been a very successful lever so far. And that's what delivers, frankly, the largest fraction of the savings. Of course, we pulled all the levers that we could around the expense side. In some cases, we had to do workforce adjustments. We held on doing any layoffs until the end of June, as we committed to. And then post-June, some campus units had to shut down or significantly scale down and experience some temporary layoffs, in a few cases, some permanent layoffs as well. And what I can say is the HR teams worked really hard to mitigate the impact to the employees by either ensuring continuity of health benefits or providing access to alternative jobs whenever we could. Thank you.
Thank you, Pierre. Next, to brief us on important updates for Return to Campus, we have Vice Chancellor of Scripps Institute of Oceanography and co-chair of the Return to Campus Task Force, Margaret Linen. Margaret.
Hi, everyone. As Anne mentioned, we have a portion of Return to Learn that's called Return to Campus, and it really is focused on the staff and staff experience and what it's going to be like for us to return to campus. In many ways, although it was leaving campus happened very quickly, being able to come back is a bigger challenge. And the context for that is that UC San Diego really wants to be the model for a student-centered, research-focused, service-oriented public university. And to do this, we're developing plans that will allow our students and researchers to return to campus in order to take advantage of the unique services and experiences of campus life. And as you know, about 25% of our researchers have already returned. But these plans depend on stopping the spread of COVID-19. And an important element of stopping the spread is reducing the density of individuals on campus. So when we work remotely, we all contribute to UC San Diego's commitment to our students. Next slide. So a few observations. Some work we know is impossible to do remotely, and it is being done on campus. Some work may be done better in person, even though it could be done remotely. Some work could be done remotely, but it's really necessary to be done on campus to fulfill the needs and expectations of students and patients. While some work could continue to be done remotely indefinitely. We're very aware of these and have taken this spectrum into consideration. Remote work expertise and opportunity are changing both staff and management ideas about remote work. And you see a lot of questions in the chat about whether people can continue to work remotely. Not everyone across the university or even within individual units will feel the same way about remote work versus in-person work. And many people will still look to in-person work as an important social and cultural aspect of their careers and their lives, even if they like to work remotely from time to time. Next slide. So we put these considerations into a set of principles, or they've affected us as we considered principles for how to return when the time is correct to return. First, it will be vice chancellors that will be responsible for decisions about staff return to campus for their units, because they understand the work better than anyone else. Second, staff will be asked to return to on-campus work only when it is necessary that their work be done on campus in support of education and research. So for the time being, if you haven't been asked to come back to work, you should continue to work remotely. City, county, state, CDC, and UCSD mandates and guidance will govern the conditions that staff will experience when they are asked to return to campus. So testing, screening, wearing masks and face coverings, all of those things will govern the conditions that we experience if we're asked to come back. The guidelines for testing and screening of employees and their implementation will be part of the overall UC San Diego Return to Learn program, which you're hearing more about today and you'll hear more about in the future. We also want to ensure that we keep equity issues in mind as we consider return to on-campus work and mitigate external barriers to work as much as we are able. So for example, we're very aware that the San Diego Unified School District decision to have fall be remote teaching is going to affect all of our faculty, staff, and students. And we have to keep these things in mind as we make plans. And our recommendations will provide a framework that will provide consistency in decision-making across the university, with the understanding that there will be unique circumstances within and across units. So we're currently developing recommendations for the vice chancellors, and these are going to be discussed with them within the next month. And then they will be responsible for putting together decisions and plans for return to campus when we get a clear signal that we can return to campus. So with that, I'll return things to Anne.
Thank you, Margaret. So our final brief update before we move to the Q&A portion will be with Terry Winbush, Senior Director of Labor Relations and Employee Relations, with some updates about symptom screening and leaves. Terry?
Thank you, Anne. Hello, everyone. So I wanted to take this opportunity to make sure that everyone is aware of the symptom screening tool that is available through the Blink website. And I understand that there'll be They've posted it in the chat for everyone to access. This tool is for everyone. So if you are reporting to work on campus or any UC San Diego work location, even if it's just for 5 minutes, you need to complete the symptom screening. You are mandated to do so by the county and therefore by UC San Diego. For those of you who work remotely, we strongly encourage you to do it because it is essential to the research that is being conducted for public health to slow the spread of COVID-19, that everyone symptom screens so that we can figure out what is happening in our community. If you make it a part of your day every day, you won't have to ask yourself that question, am I going in person or am I working from home? Should I screen or should I not? Just make it a part of your everyday. Set up the reminders. If you didn't do so initially when you registered, go back and change that in the registration, and you can have that as part of your everyday. The other thing I wanted to touch on with you all is that we have generous leaves that are available that have been provided by the Office of the President. And I say that because while there are federal leaves that are afforded for different circumstances, UC went a step further with those leaves and provide those leaves to you at full pay when the federal government only required 2/3 pay for some and half of your salary for others. So these are generous leaves. Take advantage of them when they are appropriate. Be accurate with your symptom screening because we have healthcare professionals who are standing by to reach out to you. If you screen positive for any of the symptoms that are listed, be mindful, care about your community. Know that we also have leaves that are available for those who are experiencing some of those childcare issues. We're aware that there are a finite amount of those leaves available, and that is on our minds, as Margaret and Nancy and Pradeep and Pierre all stated, as we're making plans for how people return to the community. But be accurate in your symptom screening, do it every day, and just stay healthy, everyone. Thank you.
Thank you, Terry. Thank you again to all of our participants for having submitted questions when you registered. We certainly saw some significant common themes, and we want to make sure that we address those today. Just a reminder, though, that we won't be able to get to all of the questions, so keep submitting them, and we will answer as many as we can now. Anything that we can't answer will be in an FAQ on the Return to Learn website as soon as possible. And at this point, I would like to welcome all of our panelists to turn on your cameras, get on screen so we can start asking questions. And as you all do that, I just wanted to share the names and roles of our panelists. There's a lot of people from, again, across UC San Diego with us today to share their expertise and insight. So I just wanted to read some names and let you put some names to faces for those that may not have met yet. So we have Dismas Abelman, Emergency Manager, Campus Emergency Management and Business Continuity. Cheryl Anderson, Professor and Dean of the Herbert Wertheim School of Public Health and Human Longevity Science. Otis Crockett, Senior Operations Manager and Labor Relations. Bryce Besser, Chair of the UC San Diego Staff Association. Stephen Jackson, Associate Vice Chancellor of Resource Management and Planning. Margaret Leinen, who just spoke recently about the return to campus, Vice Chancellor for Marine Sciences, Director of Scripps Institute of Oceanography. Natasha Martin, Associate Professor of Medicine. Gary Matthews, Vice Chancellor of Resource Management and Planning. Pierre Ouillet, Vice Chancellor and Chief Financial Officer. Nancy Resnick, Chief Human Resources Officer. Angela Sosha, Interim Executive Director of Student Health and Wellbeing. Stacy Smith, Senior Benefits Analyst. And last but never least, Terry Winbush, Senior Director of Labor Relations and Employee Relations. So that was quite a mouthful. Thank you all for being here. We have a whole bunch of questions, and I thought we would start with just getting right down to it. And this first question is to start with you, Pierre. Anything else that you can tell us about kind of the financial landscape, and then our next question, just to get you ready for it, will be something that I imagine is on many people's minds. What can you tell us about layoffs? And then I'll follow up with a question to Nancy.
Well, these are two big questions. So I think in terms of where we are financially, we are where we need to be based on what we know today. And I think the challenge, and you have mentioned that earlier, is that it's a very fluid situation. Right now we have a fairly solid program for the fall, but we are kind of always able to flex it, and we went full remote in the spring, and we could do that again. But in terms of the financial situation, I think what this campus did well was to not wait and just act. And I think, as I mentioned earlier, the hiring freeze was extremely important because that allowed us to protect the jobs that we have primarily. I think the cuts are exactly where they need to be. We anticipated where the state would be, and I think we have been fairly correct so far. Kind of pending a turn for the worst in the next fiscal year, I think my objective is to make sure that we don't change the guidance. The budgets have been set, and we are going to make sure that we are as stable as we can be. I think you asked the question around layoffs, and I do appreciate kind of everyone having this question in their mind. The issue for us, like for every other campus, is the vast majority of our expenses is compensation. We are a place of talent, and that's what we do. So what has been helping us is the salary freeze for policy covered employees and faculty. But we also had to reduce the number of positions that we have on the campus. We didn't have a choice. Again, attrition has been the key here. So we are not replacing most of the departures, including the ones that took place in June. We typically have a wave of retirements. And again, that has been extremely helpful. And most units have been able to get where they need to be kind of through attrition. That doesn't work everywhere all the time. And that's why we have had to use some temp layoffs. Very few permanent layoffs, and I think some units are still working through their program. I will just make one more comment, which is when there are layoffs, it's never an easy decision for the manager or for the HR teams, and people are really thinking hard, both whether we can avoid them and when they have to take place, make sure that we do the best we can do to help our staff. And for example, in the case of housing, we had to do some temp layoffs in July. We limited them to less than 3 months to make sure that we would provide benefits to everyone. That's the last thing that I wanted to see go away during a pandemic. I think a majority of the staff was able to get a temporary placement through the summer as well. So that's an example of action. I fully understand that I'm not kind of able to provide full guarantee to everyone, but that's how the campus has been approaching it.
Thank you so much, Pierre. I know it's a tough place to start this conversation, but I appreciate us sort of tackling that head on. Nancy, I'm hoping you can follow up with some insight into human resources sort of principles and approach for questions of layoffs and other employment decisions.
Yes, thank you, Anne. And like Pierre, I appreciate the seriousness and the deep concern around this issue. I appreciate that very much. So let me say a little bit more about how we approach this as an institution. When layoffs are determined to be necessary, we look very, very carefully at every aspect to mitigate the impact to people. We're mindful of the disparate impact this pandemic is having on vulnerable community members and employee groups. We're very mindful of the disparate impacts of COVID-19 on communities of color and on communities of lower compensated employees. And we think and care very deeply about these issues. We conduct a number of reviews related to layoffs, and we do that to ensure compliance with policies and with collective bargaining agreement provisions that govern and kind of provide rules of the road for the layoff process. And we also ensure that we examine multiple facets of the process, including the operational reasons and the basis for the selection of impacted individuals. So I would say this: human resources has an incredibly important responsibility to the people that we serve at UC San Diego, and we take this responsibility very seriously. My human resources organization, I can tell you without exception, we care deeply about every aspect of the process. Everyone who is involved in this process looks to see and to ensure that impacted staff are treated with dignity and with respect and with compassion. We're committed to making sure of support, such as the looking at the benefits continuation issue that Pierre referenced, but also providing emotional support services through our faculty and staff assistance program, clinicians, and making every effort to use resources such as within HR, we have a temporary work opportunity clearinghouse and our temporary employment services TES unit, where we look to try to redeploy impacted staff and offer alternative work opportunities where possible. So we do our very best to support our colleagues who are impacted by either temporary or indefinite layoffs.
Thank you, Nancy. Terry, there were a number of questions asking about voluntary options for employees who wish to reduce their hours at this time. Can you help us with a little bit of oversight or overview of some of those?
Sure. The primary way for people to volunteer to reduce their time is the employee-initiated reduction in time option that is provided through the University of California system-wide. Many people want to reduce their time by 5% or up to 50% to remain at least at a 50% status. There are many benefits to that, to the extent that it does reduce your salary. However, you do maintain many things as if you are still at your original appointment percentage. I will put the link to the Employee-Initiated Reduction in Time program in the chat for everyone in case they want to read more about it, get some information, and maybe explore if that's the right option for them given these circumstances.
Thanks, Terry. Gary, next one is for you, and it's a big one. What do you expect the new normal campus working environment to look like? What's our new normal going to be?
Well, that's a great question. Thanks for asking it. I think that a lot of what we're going to see is going to be more outdoors. What's been clear throughout the last several weeks is that the transmission of the virus is really fostered when you're indoors in large gatherings, bars and restaurants. That's as far as I'll go with that. So I think what we're going to see is more outdoor activity. We've looked at and in our faculty town hall, we had faculty asking, well, can I teach my class outside? And of course you can. So we're looking at locations to do that. I think you'll also see that there are going to be some guidance, just as you see in maybe some of the local supermarkets and stores in terms of maintaining physical distancing. So within the classrooms, we have already assessed the seating capacities, and we're starting to demark or mark off 6 feet of separation. So I think you're going to see more of that. We'll also see classrooms that, for argument's sake, may have had a capacity to seat 100, and I think the campus has said no more than 50. The county may say no more than 20. So you're going to see fewer people in those locations. Outside of the buildings, we would and are asking that everybody wears a mask unless they have some physical requirement that won't allow them to wear a mask. So we're going to see people wearing masks that haven't worn them in the past. So it really is a whole new look for the campus. So I think we're going to have to start figuring out. And one thing that I will say is that, particularly as we start the academic year, we intend to provide masks for those that don't have them. It's not going to be every day, though, because the county and the state at this point require you to wear a face cover, and we're saying a mask because the mask provides you greater protection. You will see also greater attention to sanitation and cleaning. So our staff, the custodial staff, has been working since the shutdown. So some people say, oh, return to work. No, they've been working, and they've been practicing and learning how to sanitize the rooms in an efficient and effective manner, while also considering that we've got classes sometimes with a 10-minute passing. So we'll clean and heavy clean, deep clean the classes at least once a day. And throughout the day, we will do some spot cleaning as best we can. We're also going to see people being asked to be more proactive in self-help in terms of cleaning up. So we're going to have wipes at the desks for students to use after they use a desk in individual offices. Just as we've started with the return for research, we provided some small kits that were available so people would get the idea that at the end of your workday, wipe down your surfaces, clean as best you can the high touch areas, and that will help with the transmission. You'll see our elevators. Already we've posted signs, 1 person in an elevator. I'd love to have more, but in terms of proximity, there are few that have 6 feet of separation. So I think we're going to see a whole bunch of more people taking the steps. And I think that's a good thing, even for folks like me. I need to lose some weight. So I think we're going to be, it's a different approach, but if we address it in the positive with using the great San Diego weather to be outside, we'll see fewer large groups. We'll see clusters of no more than a few students because of the social distancing requirements. So it's an adjustment. I'll stop there. I could talk for days.
Thank you, Gary. It's just amazing to sort of contemplate the scale of what you're undertaking and the accomplishment. So thank you for that. Natasha, I'd like to ask you about the anticipated frequency of asymptomatic testing for students and employees and sort of the thinking that went into that frequency.
Sure, thanks for that question. And I've seen a few questions in the chat about clarifying about the testing program. So just to be clear, symptomatic testing will be available for all individuals with symptoms. In addition to that, we will be offering an asymptomatic testing program. So we've already begun testing some employees reporting to campus within that asymptomatic testing program. And students will be tested when they arrive on campus in a staggered approach. So we're staggering their arrival, and when they move in, we'll be testing them. And then after that point, we'll start our ongoing testing program for all campus community members, students, faculty, and staff. And ongoing campus community members will be encouraged to participate in this asymptomatic testing as a kind of collective public health program that will help us resume our on-campus activities as safely as possible. And the goal of that is really to be able to detect outbreaks early. And so we did some mathematical modeling that indicated that if we could test greater than 70% of our on-campus community every month, then that would enable us to detect an outbreak before there were 10 detectable infections on campus linked to that outbreak. And so we'll encourage participation in this program so that we can detect outbreaks early, reduce the risk of their further spread on campus, and therefore reduce everybody's risk together.
Thank you, Natasha. Kind of a related follow-up question for Angela, if I may. Between the high cost and lack of supply, will there be enough COVID-19 tests for the entire campus community to be effective?
Yes, we believe we'll be okay. The health system has done a lot of work to expand its capacity. We're also leveraging our research talent, and there are some tools as well as ability to do high volume testing and rapidly for our community. So we believe we are in a good position. There's been a lot of work over the last few weeks to develop that capacity, and it continues to expand. So I think we're in good shape.
That's great and great to hear. Thank you. So this question is for Steve and let you sort of tag team on this one, if I may. Many campus spaces do not allow for proper social distancing when fully staffed. So how is this going to be addressed?
You want me to go first, or you want to take this one?
Go ahead, Steve.
Well, as you may have already seen on the campus website, we do have the protocols for the social distancing and sanitation protocols, which walk everyone, I guess, step by step through the requirements to return to learn, and it specifically addresses maximum occupancy within spaces. I know we've talked about maintaining the 6 feet social distancing, in all things as far as where folks sit, and Gary alluded to, the classroom seating. And as far as determining that maximum occupancy, individuals can work with our experts in the EOC to determine that, based on the actual layout and the sizes of the room. So that would be determined as part of that process. And again, if you want to add any more, but that the folks who will be doing that as part of their return to the campus would work with the EOC in determining that number.
Yeah, thanks, Steve. And what I would add to that is that the health and safety of our campus community has always been our #1 priority since we started this operation. And it's kind of the guiding principle for all the decisions that we make. And that's why, for example, getting the people to work remotely fairly early on in this process was fairly important, and why having people remotely is very, very important, because this will allow us to keep the density of the campus population down. It'll allow us to provide for that spacing. It'll make it less likely that we do have the close contacts on campus, which will allow us to keep the spread as slow as possible. So things like working remotely as long as we can, flexible schedules as people do return to campus, are other tools in our box and that we're using to make sure that not just the space, which we need to put in place, but are all tools that we have to allow us to get back to campus safely.
Wonderful. Thank you both so much. Bryce, next one is for you. Hoping you could tell us a little bit about how the Staff Association is engaging at different levels to help with the Return to Learn program.
Yeah, thank you, Ann. That's a really good question. So for those of you who aren't familiar, the UC San Diego Staff Association is a group of staff members on campus. We have an executive board and affiliate groups. And our goal, our mission is to help amplify the voice of staff on campus and advocate for staff. We're different than a union. We do not represent staff like a union. So I like to always point that out. So really, I think that the Staff Association has really enjoyed a very strong connection with our HR contacts and other departments on campus. And we've been very fortunate to be invited to the table to offer kind of our input in this. So, ways that we've contributed to the discussions for return to campus operations. I am part of the Return to Campus task force that is grappling with the issues about staff returning to campus and what's that going to look like from now and what's it going to look like in the future. I continue to try to bring to the table stories and other things that I'm hearing from staff. So, the staff members are encouraged to reach out to the Staff Association and tell us what's going on and your concerns, and we can always present that to executive leaders. We've also been partnering with the Office for Strategic Initiatives, OSI, to incorporate information or questions into surveys that are being developed right now. So the Staff at Work survey, for example, and other surveys that are aimed at getting information from staff about what things are they needing at this time, what pressures are they facing, and that way we can develop metrics and see what initiatives we need to be pushing through so that staff have what they need. In our discussion with campus leaders, like I said, we continue to discuss stories about staff. We continue to advocate for consistent and regular communications with the staff. So having something like these town halls is very exciting because as we can see from the attendance over 2,000 staff members, staff want to know what's going on. So something like this really just shows that we're moving in the right direction. And I also think it's important to kind of understand that the return to learn conversation, while we're talking about it in terms of coming to work on campus again, there's also part of it about how many of us are going to stay remote for quite a long time. And so the Staff Association has been looking and working hard at providing resources to staff with this in mind. So, we've continued to try to build community during this time. We've partnered with special events and protocols and other departments to develop virtual programming. So you'll see that with our virtual summer celebration that's going to be coming up. You've seen that through our Celebrate the Night event that'll be coming up, social sessions, right? So ways to create community and keep us engaged with each other even though we're so far apart. I think it's very important to realize that that's a big component of the return to learn, right? And we also have been working with folks like the Healthy Campus Network to identify food insecurity issues that our staff members might have, how we can learn more about that and provide resources in that area. So I think that those are things that might kind of fall maybe underneath when people think about return to learn, because it's not actually directly the conversation related to getting back to campus. And I do want to just maybe remind folks that, you know, our local staff association is part of a larger group called the Council for UC Staff Assemblies. It's CUCSA. And so each of our sister campuses have representatives, and it's basically the system-wide staff association group. And we look at things system-wide. So what one campus might be facing, all of them are likely facing here. And we get to actually collaborate and talk about things at a system-wide level. And so we get to work on really high-level things like, you know, what's it going to look like to return to campus for us and other campuses, what flex schedules are going to look like, and food insecurity issues, succession planning, family leave benefits, retiree health benefits. So there's a number of ways that the Staff Association is continuing to try to advocate for staff and make sure that you know, your needs are being met. And so I would just encourage you to get engaged, reach out to the Staff Association. Our executive leaders are more than happy to really hear, you know, your stories and your concerns.
Great, thank you, Bryce, and thank you for the many ways that you support our staff. I realize we have a somewhat limited time remaining, and I really want to make sure that we get to a question that is probably asked more than any other, or sort of a set of questions that are asked more than any other in anticipation of today's session. And that's really about remote work and again, kind of following up on the conversation about returning to campus. So we have a few questions here. We'll have a discussion around it. And Margaret, I'd love to start with you with a question about sort of when will staff get additional guidance about returning to work, and how much notice are we going to get, and what do we know so far?
Well, we did get notice a couple of weeks ago that we would not be asked to come back before August 31st. We are looking at whether there will be another announcement that gives people more, you know, don't worry about coming back before, you know, X date. The recommendations that we're making for VCs are going to be going to them within about a week or a week and a half. And then each of those VCs will make a plan for which people will be coming back during this phase, that is before everything returns to normal. And the Chancellor will be giving guidance to the VCs on when those plans will be due. So I think that sometime in August or early September, we'll start to see VCs talking to groups about whether they would be asked to come back during these conditions. I think that when we go into the next phase, well, we have to have a better idea of when San Diego will loosen up restrictions in order to think about whether there will be an opportunity for more staff to come back in the fall. And that's as the Chancellor mentioned at the beginning, we have to be flexible to respond to those restrictions from the state of California and San Diego as well.
Great, thank you so much. I have a kind of follow-up question for that, and I'm hoping we can get to two more questions. So let's at least. So Nancy, this one's a follow-up question for you. We've received a lot of questions around remote work availability, kind of following up on what Margaret shared. How about post-pandemic, and what about high-risk individuals and people with childcare concerns and all of the many individual specific needs that people have? What can you tell us as you kind of look out even farther beyond what Margaret has shared about kind of next steps?
Yeah, that is a great question, Anne. I saw a lot of questions both before, that were submitted before, that are submitted during this session, and that are very top of mind for me and others as we look through a lens of what I'm calling reimagining the workplace. So we have this incredible opportunity to learn from essentially a forced experiment in moving rapidly with no notice to a remote work environment for many of us. Now, I don't want to neglect or forget the very critical staff who did not work remotely and do not work remotely. We have critical, valued staff members who have continued to work on campus throughout the pandemic, and I want to acknowledge that and thank those employees very much for their work. We have many employees, though, many staff who have been working remotely, and I think who've seen this in many ways as highly successful. We also see many challenges with it. So it's a complex fabric of different factors in play. From my perspective, we can and should take advantage of this opportunity to think about what is the culture we want? What is the workplace of the future that will meet the needs of our employees? What is our employee value proposition around having workplace flexibility and around having different ways to connect and to create teamwork and collaboration and to ensure accountability and to work in a way that is environmentally sustainable, consistent with our values? And how do we also be connected with the campus and see our students and be part of a vital community of extraordinary global research and scholarship? So I think from my perspective, one thing is that previously, I will say in my mind, I really viewed telecommuting requests as kind of an exception-based request where there should be justification. And I think my thinking has flipped about this, and I think that I have seen demonstrated that we can work very highly successfully from a remote platform. And so my question really is the inverse. It is, why would there be a need to not work remotely? And I think there are real needs around spontaneous conversations with colleagues and collaboration and being connected again with a campus. There are huge benefits to that. But I think we have an opportunity to look at this very differently. I want to also speak to the important question you asked as well, Anne, about childcare and school impacts and individual employee health situations or the health situations of members of their families. So we have many, many things to take into account as we look to, I think, going into the future with greater flexibility and with kind of a renewed sense of excitement about how technology can lead to innovation, which is fundamentally part of our culture and our sort of our DNA. To me is inclusion and innovation is UC San Diego. So I look to ways that we can, through our Reimagining the Workplace Task Force, really drive to the culture we want. It's one that is deeply connected, where we use innovation and technology to support our employees in the institution, and where UC San Diego is just, an extraordinary place to work for all of those reasons.
Thank you so much. I know this is a conversation with many iterations to come. I think we want to have time for one more question if we can, and that's for Cheryl. I know this gets sort of thinking as we head toward the end of summer. How are we going to handle the normal cold and flu season along with COVID-19? Again, I realize that's a very big question, but if you have a few thoughts that you can share with us before we wrap up, that would be wonderful.
Yeah, absolutely. So, this pandemic has really exposed where the potential gaps are in our healthcare system and our public health system. It's also really allowed us to think about how well we work together and how well we collaborate and the things that we can do in a very short period of time to manage a lot. And so we will be managing both epidemic flu as well as pandemic SARS-CoV-2 and the resultant COVID-19 in the fall. And we just need to get ready for it. So our biggest ally right now is going to be prevention, meaning the things that we know are important for preventing infectious diseases or things that are easily passed from one to another, great hygiene, really keeping physical distance amongst us, covering our faces to interrupt transmission, ensuring that if we think we are infected, we get tested, we give information about the people that we may have been in contact with so that those individuals, as well as the infected person, can be removed from our communities. And so the way that we do this in the fall is to adhere to some really important public health principles and to work together as a community to ensure that we keep each other safe.
Thank you, Cheryl. I feel like that's a sort of perfect place for us to go on with these like important words of wisdom and behavioral reminders for us to keep ourselves and each other safe. We have had so many great questions, and again, I know we weren't able to get to all of them, and I just want you to know that your questions are so important, whether we were able to answer them live now or whether we'll put them on the FAQs. Again, remember that's the returntolearn.ucsd.edu site. I also wanted to give you another opportunity to share your insights as staff members. There are focus groups that will be helping the Return to Learn program understand crucial information related to campus operations, and you're going to get an email with an invitation to participate in those focus groups afterwards. So really encourage you to take every opportunity to kind of share your insights and questions. So as we wrap up here, I just wanted to thank Chancellor Khosla, our host Nancy Resnick, all of the panelists, all of you for participating. And I also really wanted to, I don't even know if I can list everyone by name, but really thank all of the people who go into making this happen behind the scenes. Megan, Max, Melanie, Darlene, Kimberly, Hallie, and many others who I'm sure I didn't include, but thank you all for everything you do for our community. And we hope to see you at the next town hall very soon. Thanks again so much.